One odd thing about the lipedema is that there is no direct correlation between the severity of the lipedema and the pain. So we do have people with just right at the beginning and they are in agony. And we have people on the right side, they have a severe lipedema, but they can cope with the pain. They are not pain-free, but they can cope with it. Over the years, I found that it has more side effects, more complications, more late sequelae than we considered at the first beginning when we started treating lipedema. Over the years, we could see, we found eye-opener that helped us to understand what the fatty tissue can cause. So first of all, I would like to talk about spine problem. Usually my orthopedic colleagues, they laugh at me when I tell them, look, this causes pain. Fatty tissue, it's a spine problem. No, it's not a fatty, it's just this sharp ankle. If you imagine, this people tries to lie on their back. It squeezes the spine in a certain direction, and this causes pain. Even if they stand for longer, then they have all this weight, and so it squeezes the spine into a curve, which also causes a lot of pain. The next picture is even more extreme. You see, this lady has almost a right ankle. And we can get rid of the pain when we reduce this fatty bulge. They are pain-free after a couple of days. So this is one reason I actually have to explain to you that this happened to me by sheer coincidence. When I did a young lady and I said, you have a bulge there, we should do this. It's a beauty issue, but we should do it. And so when I asked her to turn from your left-hand side to the right hip, when she turned over, she said, wow, my back pain is gone. And then I reconsidered this and said, maybe I missed something. And meanwhile, we do all this buttocks and all these people get at least a relief of the back pain. And in many patients that we see when we do the second operation, for example, people tell me lying on a stretcher for an X-ray is already torture for them. And when I do the arms, they have to lie 2 hours on the back and they don't complain anymore. So it's gone. This back pain is gone. It's like a miracle then. So we have another issue which is caused just by the fat. This is this valgus malalignment, which is caused just by this tiny little fatty bulge there. You can imagine when these people walk without underwear, without Bermuda shorts or something like this. They rub the skin towards each other and it hurts. So they start walking in a V-shaped manner. So, and as more as the fatty bulge increases, a more malalignment they get. You see, this power vector, the heel should be just here. But they can't because they have this fatty bulge there. This is nothing really serious, but you can already see what happens even in very early stages. So, and then you see the knee joint has a different leverage. So you have a higher pressure here than here. So you ruin your cartilage over the years. And later, as you see these people waddle on the street, so they have this penguin-like walking like this because they have to walk around this fatty tissue. And in late stages, you see, these people is just standing normal. They just stand there like this. It's not for the picture. So they have a difference between the angle of 0.5 meter. It affects only knee and ankle joint. Does not affect the hip because the hip it's a ball. This is very flexible. The ball doesn't matter in which angle it comes in. But the knee are two flat surfaces. And if you squeeze it like this, you ruin the cartilage on one side. The same on your ankle. This is just a 45-year-old lady. She might be meanwhile 55. I guess it's an old picture already. And she, when I show this picture to my colleagues, they usually tell me, yeah, you know, she's obese. Of course she's heavy, but she's not obese. If you look at the skin, what I always told you, normal skin there, you have this waist to hip ratio, and you have a completely different tissue, soft tissue there. That's a lipödem. And she can't walk anymore. She's sitting in a wheelchair. So even our insurance companies, we fought for the last 20 years, are not inclined to pay for the liposuction so far. So this lady was sent to an obesity clinic and she lost 40 kilograms. And you can imagine where she lost the 40 kilograms. Did not change a jot with her walking appearance, did not change her 1 centimeter with her legs. And on the other, they did not apply MLD, manual lymph drainage, to her during the staying in the hospital because she was just called obese. So nothing to do with lymph. So she rather deteriorated. She lost 40 kilograms, 14 kilograms, but she was in the same bad situation than she was before. And as I said, she is meanwhile sitting in a wheelchair, of course. So look at this, how these people walk. You can see she squeezes the tissue towards each other, and this ruins the knee joint. So we had to learn this, and I have written an article about this a couple of years ago, and it helps in the United States, people getting reimbursed, because when they give this article to the insurance companies, they are really aware of money. And when they consider knee replacement, which is about $100,000, I guess, or even more, and then you talk about a couple of thousand euros for a liposuction, they reconsider liposuctions just in case it might help. So we had some improvement in some countries with to have the insurance company reimbursed the liposuctions. Conservative treatment, we do have just a few tiny little things we can offer these people. Diet only with symptomatic obesity, which means if these people suffer already from diabetes or from high blood pressure, they should try to reduce the fatty tissue, the weight, which is, of course, we know this. We had this discussion in St. Louis. There was a big meeting in St. Louis last weekend, and Corinne Habs asked 5 surgeons, liposuction surgeons sitting on the panel, what they would do. And they said, yeah, we should decrease the weight of the patient. And I said, look, how can it work? Just because we suggest you should lose weight, how all of a sudden should it work? These people tried so hard for the last 20 years, and now we say, please reduce your weight because you need a liposuction. It makes no sense to me. So just as we know, many of these people just reduce the weight after the liposuction, just out of the blue sky. They didn't change anything. You remember one of the really, really huge ladies? She lost 70 kilograms over the next 6 months without changing anything. And this lady's her initial wish was she was supposed to being married, and she wanted to walk to the altar without a cane. This was her big wish. And the second day after the operation, her wish was fulfilled. She could throw away the cane. Unfortunately, her fiancé decided, or at least he found while she was staying in Germany, another lady. So the marriage didn't take place. But anyhow, she lost after this year without any change. We convinced her that she has to not nourish her normally. She should eat healthy, but not less than 2,000 calories a day. And she lost weight and she's still losing weight. She's going down to a normal weight. And I saw her a half a year ago in North Carolina when I gave gave us a presentation there. She was half the size she was there now, and she explained that now she can hike with her kids again, which is such a pleasant idea when you can give people the chance to lead an almost normal life. So we are not talking about beauty, we are talking about getting back to normal life. So this is what we call complex physical decongestion. That's just MLD, manual lymph drainage, plus bandage, plus skin care. A lot of the skin folds have some skin irritation and they need to be taken care of so that they can heal. After this physical decongestion, we drop down to the bottom line. Then we stop the bandaging and we apply compression stockings or compression panties or compression stockings plus panties. And this it's obligatory. It has to be a flat knitted compression garment. Round knitted won't help you. You have this pneumatic pump, I guess it's available in Sweden as well. So you can apply this at home just to increase the frequency, to decrease the frequency of MLD, which is not available everywhere. In Sweden, I have learned. We do have it in each tiny little village in Germany, so you can get it everywhere. And if you have the prescription twice a week or 3 times a week, you get it. So Germany, I guess, is far ahead in this point. So, and the most important thing is compression stockings. Every day you have to wear it. Wherever you go, whenever you stand up, you have to wear compression stockings. Flat knitted means you have a high chance to put in all kinds of like a wedge to make it easier for you. As I usually said, it's very difficult to find a decent fitting compression stockings. It's really difficult. You have to an experienced and really experienced bandagist, and it's not for the first time. You have to see these people because it will change. You have to change this during the time. So it's a continuous work together with your bandagist and your doctor. This is the machine that helps you at home to get rid of your fluid. I show this. I like this picture because when people come back from the physiotherapist after MLD and they have got a bandaging and it looks like this, change your physiotherapist. So this is really a mess. So this is deteriorating the whole system. So you need an experienced guy or lady who helps you with the MLD. Also, compression stockings. What I see in my office, sometimes it looks like a joke. You see, this is just the rubber band from the Lipödem cuff, and it cuts in. It's like a rubber band. Round knitted stockings can be used for this purpose. You have to have a flat knitted, and just take it out. Even if you wear nothing, you are better off without compression stockings. I show you a few things I did on a study with 100 diagnosed lipedema patients. They have to fill in an initial inquiry, a sheet which I ask a lot of questions. And this 100, I took them to a private room and I asked them even more questions about depression, you will see. So first of all, my first discovery was that most of these people had already severe eating disorders. If you look at these pictures and these figures, it might impress you. We had 60 patients out of 100 who had been treated or are still being treated for anorexia. And if you talk in this group, people come to me and say, yeah, I know, I was anorectic myself and so on. So you see, it's quite common. The really scary thing about this is that anorexia has a high death toll. about 40% of these people die from anorexia. But they don't starve to death. They reduce their immune system, and so they die from a secondary infection, a lung infection, something like this. So this is really scary. They have bulimia, binge eating, no eating disorders, without really no eating disorders. You have to go into the detail to find this out. It's just 1/4 of my patients had no eating disorders. All other of them have unspecified eating disorders. What is it? They use diuretics, they use laxatives, they vomit for a while and then go back to normal life. They have made some experience of binge eating. You know what binge eating is? No? Okay, I'll try to explain. So you starve for 4 weeks. You're really starving. And all of a sudden you think, oh, it was absolutely futile. It was pointless. Then you go to your fridge and hopefully it's full. Then you open your fridge and you eat whatever you can get. So the people describe, they put some cucumbers with marmalade and honey, and so they eat whatever they can get. So until they feel really sick, and they blame them for the next 3 weeks. For the next 3 weeks, they starve again. They just drink mineral water, and then all of a sudden they open the fridge again. This is typically binge eating. It's more known in drinking. Binge drinking is just people they have no problem with alcoholism. Has nothing to do with alcoholism, but sometimes they get drunk to consciousness. And then they live a normal life again. And all of a sudden they get drunk. That's typical kind of binge drinking. And these people tend to have binge eating. So, and as I said, so really normal, healthy food, normal nutrition is just 1/4 of these people. So if you compare it with the normal studies with anorexia, it's just 1% of the normal population. And we have about 40% in lipödem patients. So you see the high number of people which have a secondary disease to lipödem. I wondered if I really charge the pain correctly. So I asked 100 patients of my people, how is the pain in your daily life? And it means 0, it's no pain. 2 is moderate. 5 is already severe. 7, 8 is very severe. And 10 is unbearable, means it cannot be matched with normal life. So you see, more than 50%, 60% are on the other side of 5. So they have severe, very severe, or even more than 10% unbearable pain, which was even for me, when I did this study, it was surprising. I treat these people for more than 20 years, and I did this study in 2013, I guess. I was really deeply impressed to find a result like this. What is even worse is the mental torment. I talked about this. When you have these daily humiliations, when you go on the street and people look at you. I had people from United States, they told me kids are using their mobile phones to walk behind them, to film them. It's such an humiliation when they buy in this big shopping malls. People walk behind them and recording their movement. I mean, you think this it cannot match with daily life. So that's the reason why they feel like this. And one of the sentences that really impressed me when I said, "What do you think? How is your mental torment? How do you feel from the mental state?" I said, we have 0 to 10, and more than one people told me, write down 25. 10 doesn't even express what they feel in daily life. So it's really most of them, or many of them, feel they lead really a hard life. Which leads to the next slide, which explains it just without, it goes without saying. Out of 100 lipedema patients who came for the initial examination, had one or more suicide attempts. Wow. If you consider, in Germany, I read the statistics to publish this paper, 10 suicide attempts is one suicide. So we have about 100,000 suicide attempts, and we have 1,000 suicides. So that means out of this group of 100 people, I guess that at least one person didn't make it to the doctor anymore. So she had killed herself because, and the reason was lipedema. So this is really a severe, very, very severe disease.